can we start? Thank you very much.
The operating theatre, a place of hope and fear.
You've been so brave. Rest your head back, sweetheart.
Some of these patients come in, they're really scared.
You're not okay, because I can see it in your face.
We're back in day surgery at the Queen Elizabeth Hospital.
Where's the Queen?
Where the theatres, beds and staff have been rigged with cameras.
We work wonders here.
We use humour in theatre.
So you win some more local anaesthetic.
Capturing familiar faces hard at work.
No karate in here today.
Bless her, look how little she is.
Love you.
Performing complex operations.
You never know what you're going to get. It's exciting and I absolutely love it.
Is he all right? Is he breathing?
And changing lives.
Stand clear, please.
Inside the operating theatre.
I've never had anyone who said they haven't enjoyed it.
I'm a bit obsessed with my floors. I like them to be nice and shiny and clean. I do tell some people off when they ruin my floors. Can I just have a word about this lovely trolley? If somebody does do it when I'm not there, they go, oh, Kelly's not going to be very happy when she comes back tomorrow. Getting all them black marks off your shoes. Is that you, Sophie? And I never am very happy when I come back tomorrow. That's what it is, girl. I'm going to have to tell you all. Yeah. Can you do that? I feel very sad when my buffer is broken. I do like to buff.
That was very, very quick.
It was, wasn't it?
Why, I don't know, but why, I don't know. I don't know.
Hello, I've got Luke Atkinson for his operation.
Just have a seat in the waiting area.
Thank
We
you.
got the first one. I'm feeling quite excited, quite nervous, quite happy. The main thing is I wanted to get sorted out. Can I just get my back pass now?
You can't have your battle pass yet, no. Got to wait until after your operation.
How long is that?
About half an hour. They've been monitoring him for quite a while, but it's gradually getting worse over time and people are noticing. Are you a fidget bum?
It's pushing me off.
Luke was born 4 weeks early. They said that often children that are born prematurely can have these sorts of problems, so it doesn't run in our family, it's kind of out of the blue.
Have we got Luke Atkinson?
Yes.
We have.
Do you want to come through?
Yes.
How are you today?
Good.
All right?
Yes.
So, my name's Rachel, I'll be looking after you. We've also got Chris here and a couple of other people around as well, all right? I need to put these on your wrists.
I don't think anyone's been particularly mean about it, but he's aware that people have noticed it, and I think that will probably get a little bit worse as he gets older, so it's best he gets it fixed now, really.
So you come for an operation on your eye today, is that right?
Yes.
Yeah?
My eyes are so funny. Whenever I read, my eyes go really funny. Like when I stare at some things.
How old are you?
Nearly 9.
So we're 8 at the moment, are we?
Yes.
Yeah.
There's basically 2 muscles and one muscle stronger, making the other eye go to like over and the other eye straight. So it's very hard to control.
What I think we'll do first is go to the scale while we wait for the machine. So can you just slip your shoes off for me?
Okay. Okay, 1 off, 2 off.
Oh my God, we haven't got
That's
smelly
it.
feet over here, have we?
No.
It's an intermittent squint, but it's still affecting his schoolwork and his concentration levels.
Right, that's it. Are you standing up nice and straight for me?
Yes.
You're right, is he worried? Is he okay?
No, he's absolutely...
He's all right.
Yes, he's,
Eager to get it done.
He just wants to get it over and done with. He really dislikes reading, and he said the words move around on the
the page for him, and then he gets double vision, so reading is really tricky for him, and he struggles with writing and spelling as well.
So we've got the Avengers on your top. Have you got a favourite?
No, I never. Mine's just a random t-shirt.
Just a random t-shirt.
I don't like reading because there's so many words, and I'll literally get so stuck that my eyes will literally just go really funny.
Luke's surgeon is consultant ophthalmologist Mr. Singh.
How is his squint? Is it still the same, do you think?
Yes, it's still the same. It's still worse when he's reading and writing. It goes in, out when he's trying to concentrate.
Usually the purpose of the squint surgery is to improve the squint so that cosmetically it looks more of a straight. Luke, can I just put a mark on your forehead, on the right eye, so that we are doing this?
I have myself 2 children, and I can understand the stressful situation, especially with the parents when the kids are having surgery. But we try to calm them, we try to reassure them, and hopefully squint surgery can be a life changer.
And my eye hurt after the operation.
It hurts. They said it'll feel gritty, a little bit gritty.
What's gritty?
So if you feel like you've got a grain of sand in it or something like that.
I'll be trying to get it out.
No, you're not allowed to touch it though, that's the thing.
I know.
Because the grit that you feel will be the stitch.
Yeah.
So you obviously can't take that out. Exactly. So you've got to not touch it. I'm just hoping it will be a little bit better, and that when I'm having a conversation with him, both of his eyes are looking in the same direction.
Lovely. You ready?
Yeah.
Yeah.
Let's see if someone will do a
See you
then.
then.
Yeah, I'll be with you a bit longer yet.
All right.
I'm feeling frightened because I don't know what to expect, that's all.
Good afternoon, is Mr. Ebbs here, please?
Mr. Ebbs, I'm here.
Hello, sir. I'm Dave. Very pleased to meet you.
All I know, I can make out they're going to put the camera down and it's going to record from that. You go out and enjoy yourself. You want to sit here and wait here in this place.
I brought my book.
Yeah, well.
Brian is 81 and lives on his own.
I started in the fire service in 1977 and I carried it right away through to my retirement.
His friend and neighbour Christine has brought him to hospital.
I'm never going to get it finished. Carrots love tomatoes.
Brian has come to day surgery as he's been suffering with chest problems for the last 6 months.
I had a bad cold back in April this year, and this new doctor, she decided I should have a X-ray. They think they saw something, so I then had to go to have the CT X-ray. I found that there's a spot in my chest, which is, they believe is cancer.
Brian will have a camera inserted into his lungs and biopsies taken in a procedure called an endobronchial ultrasound, or EBUS for short.
My name's Alex. I'm just going to pop a little cannula in the back of your hand, if that's okay. The procedure itself is unpleasant. The patients really do struggle with having it done. If you could just relax your hand now for me. So in there you'll have me and Tiff with you, all right, and a few other people. Well done, 3, 2, 1. We're popping a scope through their mouth and into their lungs while the patient's awake, so it's quite uncomfortable and very scary for them.
Hello.
Hello. Good afternoon. Hello, good afternoon.
Hello.
I'm Dr. Sheikh. I'm a chest consultant. Pleased to see you.
Oh, you're the one that, yeah?
Doing the procedure. Do you know what we are doing today?
Only I understand that you're going to put the camera down my chest or something. That's all I understand.
Yeah.
And I don't know anything else.
All right, okay.
I don't want to know anything else.
Okay, all right. Brian was a bit scared of the procedure. He wanted to remain in a state of denial. But as a doctor, it's my duty to explain him clearly that what are the potential risks with the procedure. You had a CT scan and PET scan done, which showed there is a gland here, which is quite big, right? And usually it's very tiny. It's not invisible on the CT scan, but it's quite big. And there is a lung nodule. So we don't know what it is, but we need to investigate.
Well,
it could be cancer, or it could be something else we don't know yet.
False teeth, I reckon.
So what we are doing today is the camera test. The tube is like slightly thicker than the pan, all right?
Cool.
And fitted with the camera on the tip. We will puncture this gland and we'll take the biopsy.
Yeah.
Okay, so bleeding, infection, pain, these are the potential risks with the procedure. Hi. All right.
All right, do you want to jump on the bed for me?
I guess I need
Well done.
to.
Get up. All right. Well done.
8-year-old Luke Atkinson is about to have surgery to correct a squint in his right eye.
My eyes make me have double vision. It makes reading very difficult.
Can I have a finger?
That's
it.
Yeah, that won't be good.
They're going to do something to the muscle to stop the eye going wee. And that's all.
My name's Susie. I'm also going to be helping to look after you. I've just got a few checks to do with you. Should we sit you up a little bit?
Luke will be put under general anaesthetic for the operation.
So, can you do this for me, Luke? That's it. Can you keep pumping? You don't come around here for a rest, you know. So what would you be doing today if you weren't here, Luke? Would you be at school?
Yes.
Do you like it?
Kinda.
Kind of. You okay? You're going to start to feel a bit woozy and it's going to be a bit achy in your arm. That's it. Feel funny? Well done, Luke. That's it. Well done. To sleep now, okay?
Right, yeah. Lynn should be out here to take you back to the ward, all right? Thanks, Lynn.
I'm feeling a little bit worried for him, but I'm just wanting it all to go well and for him to have a good result and for it to be better and not worse.
He's a bit of a cool dude, wasn't he? Real chilled.
There are quite a lot of risks with this operation. Overcorrection, undercorrection, infection. Obviously, when you're a parent, you always have them at the back of your mind.
Shall we proceed, yeah?
Mr. Singh will perform the operation.
Doing a squint surgery is not straightforward. It's a very long process. Well, it requires time to do the surgery to realign in a correct way.
Mr. Singh needs to strengthen the inner muscle to centralize Luke's eye.
Squint up, please.
And the muscle on the other side of his eye needs to be weakened.
We have to be very precise and we have to cut the muscles. Measurement goes in millimeters. And the suture after that, yeah?
Mm-hmm.
He will attempt to tighten the inner muscle first.
No, I need this caliper. 4.5, yeah?
Yeah.
So you have to stretch both of them at the same level. Lift this one up, stretch this one as well. Stretch out, yeah? That's lovely, thank you, Mona.
Once the muscle is stretched out, Mr. Singh puts a stitch in either side.
And the other suture?
He then cuts out the excess muscle.
Send needle holder again.
Pulling the two sutures together, he closes the gap of the now shortened muscle.
One muscle is done, yeah? So we just got one more. Scissors to cut, so I cut, yeah. Thank you.
In layman term, weakening one muscle and by strengthening other muscle, the eye gets straight and realigned.
More of that, that's it.
Once the muscle is adjusted, it needs to be re-stitched to Luke's eye.
Thanks so much, yeah.
Over time, the muscles will heal, slowly pulling the eyeball into a more central position.
Yes, ma'am, thank you. Great, thank you.
Thank you.
Get some ointment here. Shoulder here. That's lovely, thank you.
How often do you ask them to?
Just once. Yeah. We have performed the right divergent squint surgery.
Please.
I think so all the equipments are correct.
Yeah,
accounts are
sounds
correct.
correct.
Thank you so much. You've done so much.
Luke's surgery has taken just over an hour.
Yeah, and a bit. Your vowels are on your fingertips, so A, E, I, O, U. And then you've got letters, so A, B, C, like a C, like a D.
Words or nice words?
I've just turned the alphabet.
C.
Are you doing sign language? You've got to put your gown on top.
Oh, what now?
Brian Ebbs is about to have a procedure to find out if there are any signs of cancer in his lungs.
If I had my time again, I wouldn't do anything differently. A typical day could be on the garden, pruning, ploughing, picking. I've got a big piece of garden out there, about 1.5, 2 acres, and that keeps me busy.
A camera will be inserted through his mouth and tissue samples taken. Dr. Sheikh is Brian's consultant.
Brian has several X-rays and CT scan which showed some very highly suspicious spot on his lungs, and we are highly suspecting that he has a lung cancer.
Do you want to link arms or anything, or are you all right?
I'm all right,
Sure?
yes.
All right, follow me then.
This procedure will give Brian some critical answers.
It will not only tell us the diagnosis, but it will also tell us the staging of the cancer, whether the cancer is just localized in the lung or whether it is spreading to the surrounding glands. The treatment is all depend on the diagnosis.
Hello.
Oh, hello.
Come in, Brian. There's a few faces, but we're all here for you.
Got a lot of things going on in here.
Have a lay on my trolley here, Brian.
Do I have my shoes or anything?
Yeah, keep them on, that's fine.
Brian will be awake, but he'll need a strong sedative to relax his muscles and keep him calm.
We're going to give you a really strong cup of tea then in a minute. All right?
Oh, that's what I thought. Got to get rid of my false teeth, innit?
Yes, yeah, if I take those from you, my sweet. While we're just waiting for a pop. Lovely, perfect. Thank you very much.
All right, Brian.
To help the camera pass down more easily, a numbing spray is used.
It's a big R.
So I'm just going to pop these goggles on, my sweet, just protects your eyes, okay? Well done.
Dr. Sheikh also injects some local anaesthetic near Brian's voice box.
Well done, well done.
You're going, doing really well.
You will cough, but try to hold your cough.
Well done.
Excellent, that's very hard, you did, sir.
Well
Did
done.
really well.
I'm just going to pop this mouth guard in as well, my sweet. So open your mouth nice and wide for me. That's it. And lift your head up slightly.
You're right there, sir. Yeah?
I'll try.
Here comes a strong cup of tea, all right?
We are giving you some sedations. You'll feel a bit dizzy, all right? No, lights.
Lights off, lights off.
Yeah, tube is passing now, all right?
Concentrate on your breathing, sir. Nice deep breath.
Brian will push some fluid on your voice box. You will cough now. Yeah, please.
Brian's ultrasound is underway. The procedure is grueling, but doctors strongly suspect he has lung cancer.
So you can see the vocal cords.
Nice deep breath, Mr. Reps. Nice deep breath.
Doing really, really well, okay. Doing brilliant. Well done.
Regarding the tele, they expect us to come.
Once the instrument is in position, Dr. Sheikh locates the enlarged lymph gland on Brian's lung wall. The machine can switch between camera mode and ultrasound.
Well, it's quite big, you know.
Yes, much bigger.
Can you take a picture of this one? You know?
Take a picture? Yeah.
Put the needle, yeah, go ahead.
Yeah.
Yeah, then we can go later on.
A needle on the end of a thin tube is inserted. That will take tissue samples from the lymph gland that's causing concern.
Right, scan.
All right. Try and keep your head nice and still for us, sweetheart. You're doing brilliantly.
Yep, that's fine. I can see the needle. Yep.
It's moving, you know. Yep.
Oh, that's a perfect view.
Beautiful. Yep, that's
Yes.
all right.
You okay? Squeeze my hand if you're okay. Well done.
Each time the hollow needle punctures the gland, more tissue is collected. The more samples they collect, the more chance Brian has of a definitive diagnosis.
You've done remarkably well, Mr. Reps.
Like a tubular mass or something.
All coming out now, okay, sweetheart. You might have a little bit of a cough. That's all normal. Well done. Fabulous. I'm just going to sit you up, okay?
Fantastic. Well done. You're one of the best patients we had in a long time.
You've done incredible. Sweet, okay.
We've taken the enough sample, yeah, what we wanted. Well done. You've been very good.
What we'll do in a moment, Brian, is we're going to take you through to the wake-up room, where you'll have some more ladies looking after you. We'll make sure we get you a lady.
I expect worse than that territory.
No, you've done brilliant.
You were brilliant holding my hand. I didn't know where it was. I could feel you holding it. When it got bad, you nipped.
Oh.
Great.
You were so good.
How you getting on?
Yeah, much better.
Better?
Better.
Better?
So, like, no pain.
Fantastic.
Just feels a bit tingly, but that's
excellent.
all.
There's a common perception that anaesthetists tend to be the friendliest of doctors.
Righty-ho, sir. Are you ready?
I'm ready.
Excellent. I'm going to give you some oxygen to breathe. Certainly one of the types of people it appeals to are those who jumped off a bridge attached to a bungee cord or falls out of an aeroplane. And then I'm going to give you some strange mind-altering substances.
Anaesthetics to me, I always liken it to being like a chef. No two chefs will cook a lasagna the same way. They've all got their little angle on it, what works best for them.
Any questions about the anaesthetic at all?
Nope. Who would I have anaesthetise me? That's a good question, isn't it?
Okay. Yep. Sound cool?
Lovely.
Lovely. Cool.
Your job.
Thanks. Cheers.
And I'd let Dr. Fox anaesthetise me.
He's nice. We try and have a nice off, like who is the nicest anaesthetist in the department. Then I've started playing the other two off against each other, so I can try and reign supreme.
Are you alright?
What's the name, please?
Paige Kaneko-Teresis.
Lovely. Take a seat, they'll be with you shortly.
I'm feeling a little bit nervous. I've got to have my wisdom teeth removed because one's impacted and the other one is just not coming out. I don't have a clue what they're going to do. I don't even know where to start. But I'm sure it'll be fine.
Teeth extractions are often done at the dentist, but Paige's wisdom teeth are very close to the nerves. She needs a more complicated operation, which must be done in hospital.
Hopefully it won't take long.
Nah, it shouldn't do. There's not that many people here, so...
My sister brought me here today, Billy Jo, but she's got to go to work later, so my husband's going to come collect me.
Is it Paige?
Yeah. Perfect. Do you want to pop yourself through with me?
Am I coming through as well?
You can do, yeah.
Cool.
So I've been married for a year. My husband, he's Marco. I've got a 9-month-old son called Noah, who's a little mischief. So he's grown up too quick.
Paige normally looks after Noah full-time, but today he's at home with his father.
I had a complicated birth when I had my son 9 months ago, which ended in an emergency C-section. And it was quite hard recovery. So really this should be a breeze.
My name's Louise, I'm one of the nurses here today. So, general anaesthetic rules and regulations. I need you not driving for 24 hours, okay?
Yeah.
I need you not operating any machinery or home appliances for that time either, and that does include your kettle.
I'm feeling nervous because I've never had a general anaesthetic before, and I'm also nervous to wake up with pain.
Oral surgeon Mr. Haddock will perform Paige's potentially tricky surgery.
Paige.
Hello.
Hello. I'm the surgeon who's going to be taking out the wisdom teeth. Who's looking after you when you go home?
I've got to ring my husband and he's got to come collect because he's looking after our son.
So he's on Dad's duties tonight, so you
Yeah,
get to lie in bed. Maybe that makes a change.
Took the day off work.
After you come up like a hamster for a little while, what we are with Thursday, so by the weekend it should be fine after that.
Yeah.
How old are your children?
He's 9 months.
9, oh goodness.
Yeah.
9 months. Sleeping all the way through yet?
No.
No. Okay, thanks so much. I'll see you later on.
Thank you.
Bye-bye.
I don't like dentists. I don't think people generally do, just like hospitals. Pain associated with dentists or the drilling, the smell of when they drill your teeth, it's not very nice. Right.
See you later.
Love you.
I'll give you a call later, all right?
Yeah, thanks for bringing me up. Wish there was a tooth fairy. I'd probably get a lot of money for 2 wisdom teeth.
Brian Ebbs has just had an ultrasound inside his lungs. Doctors suspect he has lung cancer, which could have spread into his lymph glands.
Whereabouts do you live?
Other side of town.
Oh, that's not far then. So have you got someone staying with you tonight?
No, I'm on my own.
You're on your own?
You're on my own.
Brian's 81. He never married and has no family to care for him.
Out of a family of, there's 6 of us. I'm the only one left. Mother, father, brothers, sisters, they're all gone. I'm the only one.
I tell you, because you've had some sedation.
I missed that bit.
You missed that bit. Did you tell Dave you got no one with you tonight? Okay, we'll have to tell him.
Well, you said everything's okay.
Yeah, but because you had some sedation, you really need someone with you overnight. Right, shall we get you back to the ward?
You want some hooters on here so we know you're coming. She ain't a very good driver.
As his neighbour is unable to look after Brian at home, he can't be discharged. It's very unusual for day patients to need to stay at hospital overnight.
Hello there, I'm calling from day surgery. I've got a chap, it's been found that he doesn't have any care overnight, and he's had sedation, and he will need a bed. Nothing. Okay. All right, no problem. Thank you, bye. haven't got any capacity at all.
Mental dose as you can, okay, because you've had some sedation, okay?
Luke, you're in the wake-up room, Luke. It's all done.
Luke Atkinson is slowly coming round from eye surgery.
All right, darling. All right.
Okay, Luke, let's take that out. There we go.
Well done.
Hi, Luke.
There we are, Luke.
Watch your
Careful
eye.
of your eye, Luke. Yeah, leave your eye, darling.
Don't touch your eye. You've got a little shield on, mate. Stop you rubbing it. Can you open your other eye for me? Lad.
Good boy.
Do you want to go and find your mum yet, Luke? Should we go find your mum?
After 15 minutes in recovery, Luke is ready to return to the ward.
Harry B. He's fine.
Oh, is he?
Yeah.
Hello. Come back with Mum now, Luke.
She's got an eye shield on, which we just need to watch, Mum. See you, mate. All right.
Thank you, thank you. Hello, darling. You all right, sweet? Yeah, I know. Rest, rest. It's all right.
Hello.
Such a brave boy. You have. You've been so brave. It's all right. You're a big brave boy now. You've been so brave. No, don't open that eye. That's why it's got this over it. You don't need to open that eye. You can see Mummy out of this eye. All right?
Luke has to wait for the anaesthetic to wear off before he can go home.
Have a sit on Mum's lap. You'll probably feel better.
Oh, you're such a big boy. Nearly as big as me.
Oh my God. You're going to have to stand for half a second when your mum finds the chair.
All right, darling.
Well done. Let me literally. Well, listen, if you promise not to rub your eye, I can take it off for a short while until you sober up. There you go. But you mustn't rub your eye, okay?
You can't open it. Why do I have to be like this? I love you too, darling.
Okay, we're just going to give you a little bit of oxygen, and I'm going to give you the magic stuff to send you off to sleep. So next thing you know, those teeth will be gone.
Paige Kaneko-Teresis is about to have 2 wisdom teeth removed.
Yeah, it's not.
Marvellous. Just check the local there.
How many are we taking out?
Just both lowers, right and left. Okay, can I have a 15, please? Oh, she's moving. See how much distal wants to come. Right, so we have the meso root, which is locked but intact. Have a wash, please.
The wisdom teeth are the last teeth to come through, and sometimes there's not enough room, so they grow at an angle, and that's when they become impacted and they don't come through.
Helen, put some local in.
Okay.
They can cause a lot of misery and suffering for the patient because of recurrent infections or because of decay, because it's difficult to clean back there.
Okay, so again, the 5's up against the 3. So that you can see the bone which you need to remove because it's got such curved roots. Da, 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 da.
Mr. Haddock moves on to the second tooth. But it doesn't come out in one piece.
We keep this. Right. So the crown's gone.
Yeah.
Now I've got these 2 roots.
As with any tooth, you want to remove it whole. when any tooth breaks, including a wisdom tooth, it can't make it more difficult because there's less of a tooth to get hold of, and then you're down to remove the roots, and it makes it more difficult that way.
This is not the easiest of cases. Come on. Oh, no, if it is, it doesn't want to. Okay, so it's lying on the ID. Can you still see? Can I have the other cryos, please? Right. Now.
It takes another 5 minutes to get the root out.
So there it is. Okay, so it's lying on the ID and it's intact. Okay, so the patient reassured, there's not likely to be any paresthesia that's come out clean. Can I have a wash, please? Okay, we are finishing up. Thank you so much for everybody's help.
All done, Paige. You're just waking up, all right? Just a little bit of oxygen there. Let's just sit her right up. That will help her to... Oh, there we go. Okay, we can go to recovery if you want. A little bit of extra oxygen there. Right. Can you get me the tubes up? There, well done.
Paige, just going to take these out your mouth. Just give your mouth a wipe. That's it. Nice deep breaths. Right. Paige, it's all finished. Okay. You're just waking up from the anaesthetic. That's why you're coughing.
It's Katie down in day surgery. I have a chap, he had some sedation. Sadly, he doesn't have any care at home, it's been found. He lives alone, yeah. Okay, all right, I'll try and go.
Thank you very much. Bye-bye.
Okay, thank you. Cheers. Thanks, bye.
Brian Ebbs's neighbours have arrived to take him home, not knowing he can't be discharged. Staff have been desperately searching for a bed.
Yeah, just one second. All right. Brilliant. Hopefully he's just going to tell me that there's a bed. Hello, Staff Nurse Warren speaking. Hi, Di. Oh, wonderful. No, that's fine. I'm really grateful. Right. Okay, no problem. Yeah, I will do. Thank you very much. Bye. Right, I can go let him know. Okay, good news. We've got you a bed on Marham ward, okay? But it's not going to be ready until about 7:30. Okay? I could see about whether the kitchen can sort you out with a meal. I don't know what they have, but I'll ask them. All right?
All right, okay.
Paige Kaneko-Teresis has had 2 wisdom teeth removed.
Are you feeling all right? Just a bit disorientated? Right, so your mouth's going to feel strange and a bit numb. That's the anaesthetic they've put in. Right, I need to have a look inside your mouth. Can you open it really wide for me? Is it uncomfortable, like an ache, or is it really uncomfortable, like really painful? How would you describe it? Painful. And then we'll give your face one last wipe, because you can't have your husband coming in and seeing you in a mess.
baby. It got my teeth.
Yeah.
Blood everywhere.
2 poos this afternoon.
Oh, 2 poos.
Fell asleep with him at 3:30 and then he was just going, he woke up going, and then went back to sleep for an hour. So I had to baby wipe and hoover the car seat out as well, because I gave him those biscotti biscuits from Tesco's.
Oh no. Hello. Where are your pants? Where are your trousers? They told me I can eat mashed potato and rice, basically stuff my 9-month-old son eats. It went really well, and I'm really looking forward to getting home.
The anaesthetic is finally starting to wear off following Luke's surgery to correct his squint.
Can you see it now? Let me have a look. Oh yeah! Yeah, I can see your eye. Yes, I can. How weird is it? It's not weird at all. It's not weird at all. Oh, you opened it. It's a little bit red.
See, it's going to feel better with every minute. I think you're just a little slow to go. I told you it'd get better. Well, you'll be like back to normal tomorrow. I'm going to have to pop that little patch back on before you go as well, so just so you don't rub it, all right? Just for tonight. It's a small price to pay for being handsome, innit? Huh? Right, come on, beautiful, let's get you home.
Luke's right eye is improving following his squint correction, and he's having regular checkups with the surgical team. After Paige's operation to remove her wisdom teeth, it was 4 weeks before she was able to eat normal food. However, the surgery was successful and she's no longer in pain. And Brian's ultrasound confirmed he does have lung cancer and that it's terminal. He's decided not to have treatment.